Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. With us we have Vegas' hottest plastic surgeon, Dr. Stile. Okay, more photos.
Randy, this is another example of the same type of patient that I previously showed you. It's a woman who's got both a weight and skin issue here. And her biggest concerns were, you know what, she doesn't feel very feminine. She does not like to wear certain clothes that, and she feels that most clothes aren't flattering. So she wears a lot of loose, non-form-fitting stuff. And she said, you know what, I've never really had a waist.
They say this on the consult when they talk to you.
Yeah, they do, and they're usually very sad.
Really?
Yeah, it's a difficult conversation sometimes, you know, because there are a lot of emotions involved here. But what I suggested to her, in addition to diet and exercise, was both a combination of a tummy tuck and suction-assisted lipectomy of the flanks and abdomen. And what you can see here in the post-operative picture
very nice.
is a really nice result, a very natural-looking result. I mean, this woman looks like she lost 20 pounds when
it's
in fact
very
she
smooth,
probably,
by the way.
Yeah, when in fact she probably lost about 5 or 6 as a result of the procedure.
That's only about 5 or 6 pounds.
Yeah, 5 or 6 pounds taken out in the right area looks dramatically different. So she has no lumps, very
that I can see.
natural-looking belly button, and a soft-looking scar.
What does she say to you, by the way, when it's all done?
Thank you.
Is that right?
Thank you. Yeah, and how much it's changed their lives. You know, their sense of self-worth and self-esteem, which is
you say there's a lot of people, their self-esteem is really tied to this little bit of fat.
Self-esteem dramatically changes. They feel younger. They feel more attractive, sexier. They feel more confident wearing clothes that they haven't worn in decades. And it's nice to be able to do that.
The women are wearing lower pants today. I mean, really showing off their their abs more than ever.
And because of these changes in fashion, you know, many women are uncomfortable with wearing clothes like that because of issues that they have. And for some of them, having some of these procedures helps open up a whole other world in terms of choices that they have with respect to clothing.
Why is it important that you go to a doctor that does both a liposuction and tummy tuck? I mean, if you're going to get a consultation.
Well, there are some patients that liposculpture or lipoplasty alone will give them the results that they're looking for. There are some patients that a tummy tuck might, but there's a large group of patients that need both.
But not all surgeons do tummy tucks.
No.
I mean, quite a few guys don't.
No, there's
they
some
just do lipo.
Right, or they're uncomfortable with lipo and just do tummies. But for some patients, a large group of patients, you need both to achieve the results that patients envision for themselves. If a patient has a huge skin issue or skin redundancy, doing lipo will just make that worse. You have to address the skin issue by doing something like a tummy tuck or a paniculectomy, even if someone's very large. And you can use the liposuction or liposculpture as an adjunct to that to take a B+ result to an A+ result.
Okay, now for the sake of time, you have some men in
yes.
here.
Okay, here's an example of a typical.
You're very proud of this one, by the way.
I'm very proud of it because the results are optimal and they're very natural looking. Here's a guy.
He's in pretty good shape. Why lipo for this guy?
Because if you look really closely here, he's got 2 issues that were significantly bothering him, and it's both his chest area, his breasts, and his area around his belly button here. And if you look, I mean, he's got a significant fullness to his chest area that almost looks feminine.
Okay.
And he's got this fullness in his lower abdomen and his flanks here.
And he's a workout guy.
He is, and he was fit. He was a relatively fit guy. But if you look at his post-operative pictures here,
very nice.
The guy looks like he's lost a tremendous amount of weight, when in fact he really hasn't.
It looks like a skinny version of him.
Right.
I mean, that's just lipo.
We've actually just softened up the contour on his flanks, taken down the fullness in his chest and breast.
They say the chest is very tough too.
It is tough because the tissue is fibrous, and you have to work really hard to get a nice result. Now, Randy, you can imagine, look at this guy. Do you realize how much more confident he is as a result of this, or how much better he feels about himself? You know, he's finally getting the result that he wants with diet and exercise, and because of this procedure.
So it's not going to come back. I mean the fat, like that fatty chest that he had before.
No, once fat is gone, it's gone. You know, patients are really concerned about
it really
things
doesn't
like that.
come back?
They say, hey, is this going to come back? Am I going to need this again? Am I just going to gain weight somewhere else? That's the popular misconception.
Yeah.
Now, if you have a healthy lifestyle, including diet and exercise, this is not a ticket to eat irresponsibly.
Okay.
You know, as long as you continue along those lines, you will not get this back.
Would you ever get lipo?
I've had liposuction,
You've had lipo?
which is why I'm an advocate of it. You know, for me, I was always a fit guy, working out, dieting to the point of starvation, and I still, when I looked in the mirror, I saw my dad.
Is that
you know?
okay?
And because of that, you know, and for me, growing up, it was always like a cop-out to have a surgical procedure for something like this. But in fact, it was the answer to a lot of my frustration. I had it. You know, I've never struggled with those areas, which was abdomen and flanks for me, and I've been very happy. That's why I'm confident recommending it, especially to my male patients.
Okay, now we have more photos.
Yeah, I'm going to show you some more views of the same patient. Here's a side view. If you notice, significantly flatter in the after picture. And the most important picture here
is this a different guy?
This is the same patient. If you look at him from the back, he looks like he's 15 or 20 pounds lighter, just because we've given him a nicer, thinner waist.
Almost.
Well, look at how much broader his shoulders look because we've taken his waistline in. I mean, this is a person who's lost about 2 inches on his pant size.
How soon can he go back to work? Or any of your patients, male or female?
Well, a liposuction patient, because we have very small cannula sites, the incisions are small, they can go back to work in a matter of days. They can be back in the gym in a week.
So they could go on a Friday and come back?
Yeah, as long as they have an uneventful recovery, absolutely.
You have more males?
Yeah, here's some more. I think it's important for you to see these because they're good examples of typical males. If you look at this patient, you'd say, hey, this guy's pretty fit.
Yeah,
you know,
he is
and
fit.
he is. But what he wanted, he said, you know, Dr. Stile, I work out hard and I diet and I'm trying to be very responsible, but you know what, I don't see my abdominal muscles. And you know, when I look at myself in the mirror from behind, I see flanks. I look like an older person, and I should because of my body habitus. And we did lipo on his abdomen and flanks, and we've got excellent
Small
results.
waist.
Absolutely, and you see more definition on his belly. But most importantly for this patient, when you look at him from his back view here, he looks like a totally different person.
Yeah.
If he didn't have that decorative tattoo that you see here, you might think that this isn't the same person.
Yeah.
But it is. He's got a very small waistline that makes his shoulders look broader. He looks more athletic as a result. Here's another one. She had what I described earlier as my typical complaints for a female. She said, you know, I have these saddlebag areas here, and I don't like the fullness on my inner thighs, and they almost touch in some clothing, and it doesn't make me look the way I'd like to. So she shied away.
So what did you do on this?
What I did on her, if you look carefully, I've given her rear end a rounder contour. You know,
How do you do that, by the way?
Well,
because you're right, it is rounded.
And not only did I do that, I really refined the overall appearance of her inner outer thighs. They've taken away some of this fullness here that makes her legs look a lot more refined. Yeah. And I mean, her overall form here is far more feminine, a far more youthful look in what is a middle-aged woman. And this is technique in a lot of work.
So you went all the way around the thighs?
Yes, 360 degrees, turning the patient over on a table. It's like 4 different procedures on one thigh. You know, you have inner, outer, posterior, and anterior thigh.
The buttocks. So you're able to do the buttocks. So you actually, you're sucking off out right at the fold, or where are you hitting it?
Beneath the fold and coming around the top to round it off a little bit. I'm going to make another point about this patient here. I mean, this is a woman who's thin. She's thin anyway, and some people looking at this would say, hey, you know, that woman's thin. Why would she have liposuction? She has it. She's had this procedure because she fits better into the clothing that she wants to wear, or she would have liked to wear. Okay, there are other areas, very small areas. We're talking subtle here. The groin, the suprapubic area, or around the belly button, where women who wear form-fitting small
like tight little dresses.
Exactly. It gives them a look. It gives them a little bit of a sloppier look, and they're fit. Otherwise, they step on.
It's hard to get rid of that area, though. By the way, everybody.
Well, it's hard to get rid of it with exercise and diet, especially if you're at your ideal weight. You know, I don't recommend starvation as a means to achieve an aesthetic result that you can with a procedure, a small procedure. And for this patient, she's very happy. As a result of this, she continues to diet and exercise, you know, but now she has the results she wants.
We haven't talked about arms. What about arms?
For the right candidate, you can achieve phenomenal results. It's all about patient evaluation. For a person who has a little bit of upper arm fullness,
Like there's thin everywhere else, but they have
or
some chubby
upper
arms.
back where they'll have a little bit of an overhang,
The bra strap
or bra
area.
strap area.
You do that area.
Absolutely, and it's more popular than you might think, or more common than you might think.
How well does that treat?
It treats very well. As long as they don't have a huge skin redundancy, most of the skin will retract.
Okay, necks.
Necks. I brought some examples of what I call the neck or the submental area. Once again, these are patients that do not have a huge weight issue, but regardless of how thin they are, they still have some fullness under their neck.
Is that an easy one for you to do? Get the neck?
It's easy for me.
Easy for you. In the after, he looks like Ryan Seacrest.
Right. I mean,
He's a handsome guy.
guy looks a lot thinner and a lot younger as a result of that, and he could not have achieved this with diet and exercise alone. This is a guy who diets and exercise already.
Looks a lot younger.
Absolutely. Because we associate certain things with being older, and this full neck look is something we attribute to an older or more mature person. And here's a young woman who similarly had the submental or neck area done, and she looks a lot thinner. She has a round face, but had a neck that was full as well, and it bothered her. So we did a small liposuction, liposculpture in her submental region, and she's very happy right now.
Fitter. We're out of time. Final message. Somebody watching this, and for whatever reason, they want to get something done.
The final message is simply this. If you have an area, a fatty area that bothers you, you're a responsible person who's dieting and exercising, and it's just not getting better, there are ways to make it better. And liposuction now is safer than it's ever been, and you can be happy.
What about a heavy, heavy patient that goes to you, but they tried diet and exercise? They're about as thin as they think they can. Are you going to turn somebody away?
Well, absolutely. This is not a weight loss tool. I've said that earlier. This is a contouring tool where we just try to make certain areas look a little bit better.
But you do have heavy patients that are 60, 70 pounds overweight.
I do, but, well, you know what? I have a cutoff in terms of a body mass index, and as long as they're not higher than 30, they're a reasonably good candidate as long as you're healthy.
Dr. Stile, always a pleasure to have you on the show.
Great to be here again.
All right. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
How you're looking at it. Another thing that I want you to realize is that for this patient, her concerns were both in and out of clothes. Now she feels more comfortable in form-fitting dresses or in pants, and she also feels better in a bathing suit on the beach.
All right, all right.
Our next patient is an example of a woman who has multiple issues. This is a woman who was a little bit overweight and was not initially a candidate for either a tummy tuck or a liposuction, went on to lose weight, and ended up with a redundant skin issue. Now,
So the hangover, is that what you're talking about? Where the stomach hangs?
Exactly. Now, for this patient, if I were to do liposuction alone, it would make a problem that already exists worse. So for her, I did both liposuction of her flanks and abdomen, as well as a tummy tuck. And what you see here with this patient
very nice.
is a very smooth, natural-looking result. It looks like she lost a lot of weight. There are no contour abnormalities here, no dimples or lumps or bumps. And what she has is a significantly improved waistline. Extremely happy.
Now that's a huge difference.
Absolutely, and for her, it was a life-changing difference.
Why do you say that? Why do you say that?
Here's a woman who basically, had kids, and is finally wanting to do something for herself. She worked very hard, did not devote a lot of time for herself, and now she wanted to do something to give herself something back, almost like a reward.
Is this common?
This is very common. It's a lot more common than you might think, but you wouldn't know it because this patient and patients like her wear loose clothes that are not form-fitting because they're very self-conscious about how they look. But after having surgery, you know, you'd be surprised at how the wardrobes change.
Now, I've been told the problem with the tummy tuck, though, is the belly button.
You know, it is a problem. I've seen results that are less than optimal, but it's not a problem that I have in my practice. If you look at this patient, very natural-looking belly buttons with no stitch marks or any
you wouldn't know she had
excessive
anything
scar.
done. Where'd you hide the scar, by the way, for this tummy tuck?
The scar is right there. It's out in the open. I take all my post-operative pictures without concealing my scars because I want...
It's not touched up.
Absolutely not. And I want my
Okay.
patients to know what they can expect. Now, if you're healthy and you don't have any healing issues that are a result of your genetics, your particular skin type, you should expect to have an eye scar.
Now, we were sitting in the green room, and we were talking about a thin celebrity.
Absolutely.
And I said, if you do thin people, you're going to get the bumps. I said to you, and you
That's
said...
absolutely not true. I mean, it's all a result of judgment and technique. You know, there is a certain amount of fat you must leave under the skin to achieve smoothness. You know, and you also have to be very responsible and very prudent with how you do this procedure. If you're too aggressive, you will get lumps and bumps whether the patient is heavier or very thin. You know, there's some
So it's
patients...
not a straightforward procedure? I mean, it seems like you're just going in and sucking fat.
This is not a cookie cutter procedure. You know, you have to really tailor this to each patient, you know, and...
Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
So that the average woman is represented here.
Okay.
And all of these have been done the same way, a dual plane technique, going through the nipple areola complex. And as you can see, they have very natural results with incisions that are minimally detectable, if detectable at all. I mean, you have to have close scrutiny here to be able to see these incisions.
Now, I mean, at what point does somebody need a lift or just an augmentation? After pregnancy, they start losing, I guess, starting to develop sag or lose volume?
A breast is made up of both fat and breast gland. And with age or pregnancy or both, you have a loss of fat and breast tissue. And what happens is the breasts begin to sag or become more ptotic. And with time, this ptosis or sagging can be significant enough to be distressing to many women.
A lot of women, you know, in anticipating this interview,
right,
you know, I've talked to some people, and the big fear is the incision, the scars.
Sure.
That doing a lift is a disaster.
Well, yeah,
what is your response to that?
They'll say things like, I don't want those Frankensteinish scars, or I don't want that anchor type scar. And it's because they've seen many scars that were not ideal, and they're afraid of it.
But that's in the hands of the surgeon, you say.
A lot of it has to do with technique. Some of it, there are patients who have healing issues, and that's genetic, and it represents their typical healing, which is not great. But what the doctor can control is the size of scars, the placement of scars, and the attention. Once again, it's all attention to detail. If you spend a lot of time closing these wounds...
You spend 40% more time, you say?
I think so. I think so. A lift will take me 3.5 to 4 hours to do. And some people think that's a lot of time, but my results speak for themselves. I spend a lot of time with my patients after surgery as well. You know, I do my wound care myself. I like to be very, very in control of what's going on with my patients.
Now, you have some of these lift photos.
Yes. You know, most of the photos that I brought here for you today, Randy, are 3 months after surgery. So the scars have not matured completely, and even though they're only 3 months out, they're minimally detectable.
I hope we can show this on TV, because and these aren't touched up,
no,
as you said.
No, not at all. And I brought various...